Dr. Godwin Godfrey is on a mission to heal as many broken hearts as he can.
People around felt that this is kind of care that we are not ready to handle. And we got a lot of resistance. Even in the government, they said, no, it's impossible to do this kind of care here.
After 5 years of intense training in Israel, he arrives home with a special distinction: Tanzania's only pediatric heart surgeon capable of doing open heart surgeries on small children. It's a distinction that is both an honor and a burden.
The problem again is when you're working as a cardiac surgeon in Africa, that you are confronted with so many patients, and at the same time, you don't have any equipment to manage them.
This week on African Voices, we get to know the doctor determined to look after the hearts of children and learn of his journey from the shadows of Mount Kilimanjaro to the hospitals of Israel and back again. Dr. Godwin Godfrey has just returned to his homeland after training for 5 years abroad to become Tanzania's only pediatric cardiac surgeon capable of doing open heart surgeries on young children. How did a boy from a village beneath Kilimanjaro end up becoming the first child heart surgeon in the entire country in Tanzania?
Well, I can just say it was a miracle. And growing up then, I never thought I would be a cardiac surgeon. For sure, I knew that I wanted to be a doctor. And because I grew up also in the family where my father also is a doctor, and we looked up to him like our hero, and whatever he was doing, this is what we wanted to become.
It, of course, wasn't easy. Unlike in developed nations, doctors are by no means well off in Tanzania. Dr. Godfrey grew up with a wealth of beauty around him, but it was tempered by the abject poverty that also exists in the country. Tell me about you growing up as a child. What was it like where you lived?
Well, I grew up in this beautiful town called Moshi under the slope of Kilimanjaro. And I remember growing up as a young child, going to school, and in the morning we'll see a lot of tourists taking a picture of Mount Kilimanjaro, and we used to be very surprised, and we look at them and say like, what is wrong with them? They come all that far away from Europe, and they're wasting time and resources taking a picture of the mountain which is not going anywhere. Growing up in the family where my father, as a doctor, my mother also educated woman, our family, they put education first. I still remember when we were young, and if we needed a pair of shoes or a pair of new clothes, our father always used to say, no. You don't need more than 2 pairs of shoes. But we got every book that we wanted.
Education, he says, was the key to nearly every opportunity he has had. And Dr. Godwin has big dreams. But his aspirations are about improving his country instead of simply enriching himself. With your skill now, you could be a doctor just about anywhere in the world. Why return to Tanzania?
Somebody has to do something. And this is one of the reasons that I came back. But do I feel confident that I will be able to build a good department and a good team? Well, not really. So I'm also very terrified of the fact that I'm worried that maybe we might not be able to build this good team. But again, it's these worries which will keep me up on my feet every day to try to push a little bit harder, especially if you look at the environment that you have seen so far.
When it comes to impoverished African nations, the world often hears about AIDS, malnutrition, and malaria. But there are a multitude of other medical conditions that need tending to. The statistics for the needs of children with heart problems are astonishing. In Tanzania's largest referral and teaching hospital, some 300 children per year await surgery. And that is just one hospital. There are thousands more in need.
7 years ago, as a young doctor practicing in Tanzania, I had my mind set up that I wanted to do plastic surgery. And I even made application to go to Canada to study plastic surgery. And And then we got a Tanzanian cardiac surgeon who had trained in the UK more than 20 years ago. He retired from where he was working and he returned back to Tanzania, and he wanted to start a cardiac center here in our hospital. And he recruited me in his young doctor staff. And it's when I started working with him that I realized, really, as a plastic surgeon in Tanzania, we really don't have that so much need for plastic surgery. And I realized children are the ones who are suffering most in Africa. We have so many children with heart diseases dying without any care. And those few lucky ones, the government get to send them abroad for surgery. Even till today, 7 years down the road, we have several hospitals trying also to develop cardiac surgery departments. But again, even in our list of the children who are still waiting for surgery, knowing that soon we are going to start open heart surgery here in our hospital, we made some calls to call these patients back to the hospital, and at least 5% of all the patients we called, the reply on the other end was that this child died 2 months ago, or this child died a month ago. So this is why I really decided that pediatric cardiac surgery is something I want to pursue, because I just wanted to make a difference.
A walk through Bugando Medical Center in Mwanza, Tanzania, gives you a glimpse of the overwhelming need for doctors and trained medical personnel in the country. This is just one floor of the hospital's children's ward. Here, the beds are occupied at all times by 2, sometimes 3, very sick children. On this day, new young patients with heart problems and their families line up on benches outside examining rooms. This young boy waits patiently, but he has to squat because it is the only way he can breathe comfortably. When it comes to health care here in Tanzania, is it still fair to say that it is an absolute luxury to see a medical doctor, even if you're very, very ill?
From the statistics, more than 70% of people living in Tanzania live in the villages. And these are places where you don't have hospitals. Maybe if you have a hospital, this is a hospital where you don't even find a doctor there. Now, having a population of 44.9 million, according to last year's statistics, and if you look at the registration, we only have about 5,000 doctors. And what does that mean? This is also a list of some of the doctors who have retired, some who have even died. So you can realize what a big burden that we still have. And many doctors don't also want to go out of the big cities. Every doctor wants to work in a place where there's at least some medication. There's even a ward, not too packed with patients, that they can also provide this kind of care. Now, going to the village with all the knowledge that you have acquired and you still cannot manage to do anything, these are places no doctor wants to go.
It is a far cry from the wards where Dr. Godwin trained to be a pediatric cardiac surgeon in Israel.
In our hospitals, one bed, you even see 3 children in one bed. And if one has infectious disease, can spread to the others in the same bed and the next bed. And again, from the conditions that I was working in Israel, very different conditions, and it's again, many doctors, many health workers don't want to come back, not only because of things like salary, which many people seem to be concentrating on, but also because of the environment that you have to work on. You run out of everything except patients. And this is one of the biggest challenges that health workers have to face when they return back home.
Coming up, the meeting that changed the course of Dr. Godwin's life. It could have lasting effects on the lives of Tanzanian children with heart problems.